down and go to the bottom and then take another angle.
No.
Yeah.
Hello, 911. What's your emergency?
Someone fell down the stairs and is laying on the left side of their body, and it appears that there's damage to the right side as well.
Does it look like there's any damage to the axial skeleton?
What's that?
It's the region of the body that includes the head, neck, chest, and abdomen.
Yes, it looks like there's damage to the abdomen.
Is there damage to the appendicular skeleton?
Hello, we have a patient who has fallen down the stairs and is badly injured.
Please describe his injuries from most severe to least severe.
There seems to be a bruise superior to his stomach.
Is the bruise inferior to the collarbone?
Yes, and it seems to be anterior or above the heart. He also has a deep cut on his shin.
Let's go back to the bruise. Is it located more medial or lateral?
It is located over the heart, so it's more medial, meaning it's down the midline.
Okay, we will look at that more closely when you get here.
There also seems to be a part of his arm that is proximal or closer to the attachment point from his wrist, and distal or away from the attachment point from his shoulder. And there seems to be cuts that are superficial or towards the surface of the skin on the bone that is broken.
After close observation of the dorsal body cavity that protects the nervous system and covers the skull and spinal cord, I've concluded that he has major injuries.
What part of the dorsal cavity?
Primarily the cranial, which encases the brain.
What about the vertebral cavity that encases the spinal cord?
There seems to be no damage there. The majority of the damage is in the ventral, which contains the internal organs.
What part of the ventral cavity?
The thoracic cavity, which contains the heart and lungs, seems to have internal bleeding over the heart.
Is there an abdominal pelvic damage, which contains the abdomen and the pelvic? Have any damage?
The abdominal cavity contains the intestines and other organs, has no apparent damage.
It looks as the pelvic cavity containing the bladder and reproductive organs are okay.
Okay, let's first cut the patient on a sagittal plane, which divides the patient into a left and right section.
I think we should cut him in mid-sagittal plane, which is cut down the midline to form a right and left side.
Following that, we should do a frontal cut that divides the patient into front and back sections.
I agree. While in surgery, we should also do a transverse cut, which divides the body into a top and a bottom part.
So please make an incision from the left upper quadrant to the right upper quadrant. That is the top 25% of your abdomen region.
I think it's safe to say, since there's no bruising, there's no damage to the right and left lower quadrants, which are the bottom half of the abdominal region, or the hypogastric region, which covers the reproductive organs.
Yes, that is true. I'm worried about the ribs located in the right hypochondriac region, however, in addition to the epigastric region, which is the center part of the top of your abdominal region. Not only is the heart located here, but most of the bruising is in this region.
You mentioned injury to the right hypochondriac region. What about the left hypochondriac region?
Alright. It really does not appear that any major damage went on here.
After surgery, he will need to wear a brace going around his right and left lumbar regions, which are the sides of on the top of his hip bones and across his abdomen, and his umbilical region, the center of his abdomen, correct?
Yes, I would say that's a good idea.
It really is a good thing that there's not any damage to the left or right iliac regions, because these are bony areas that can be hard to fix because they're located on top of his hip bones. Go ahead.
We're all done with surgery and the patient is doing well, but we told him next time he needs to be more careful down the stairs.